Hello, Leslie Wise. I am the principal and founder of Evidence Matters, which is a global market access strategy company. I've been in MedTech for over 15 years, uh, worked at Biomed Orthopedics and built their market access framework and then angiodynamics. At the same time, I headed global health policy for both companies, so I've done a tremendous amount of work with Abdomed, the Cures Act 1, breakthrough technologies, getting things through CMS to complement the breakthrough program with the FDA. I've sat on every kind of committee. I currently am on the MedCAC, which is the Medicare Evidence Development, Coverage, and Analysis Committee. In a nutshell, that's it. I could go on and on, but I think that's enough.
Hi, my name is Ariana McGee, and I am the founder and CEO of Navigate Maternity. We are a tech-enabled medical device company. Our flagship product is our remote patient monitoring system that manages prenatal and postpartum patients, and we enable the care teams with the data they need to intervene with mom before a catastrophic event takes place. My background, I've been in MedTech for the last 11 years. I started off in pharma and biotech and then moved over into global market access consulting, where I worked with my mom, Leslie, and learned so much from her, from working on so many different projects with her. And then fast forward, went and worked at a large medical device company, went there as an associate director working in market access, and then actually headed US market access across divisions at a large global manufacturing company. So have really great experiences within the medtech space, but so excited to be here today.
I've been involved with MedTech Color for about 5 years, 5 or 6 years. I think that the mission is, it's beyond important. It's everything. It's how we're going to grow the engagement of people of color in the medical technology space. When I came into the space, on the executive level, there was no one but me. And, because I have a probably unique personality, I didn't feel as isolated as I know many other people did. There are other people that had roles, and then they would be in them a short time, and they'd leave because there was no sense of community. And so MedTech Color has created that. And then the collaborative community is very, very important. Like today at the breakfast, they talked about building a network of PIs with diverse backgrounds, because that's one of the things you hear from companies all the time. Well, I can't enroll people of color because I can't find them. And you say to them, well, enroll their doctors in the studies, and the patients will be there. And so, we're creating the tools at MedTech Color to lead to long-term change, not just this year, and so people can't say, well, I don't know how, because MedTech Color is giving them the roadmap. So that for me is very exciting.
Yeah, definitely. I agree with you there. MedTech Color has been absolutely imperative to my journey as a professional within the MedTech space. I've been now part of MedTech Color even prior to starting my company, and it was amazing then. I was learning so much at, being part of the collaborative calls, being part of the committee working on diversity in trials, and then now that I'm a founder and I have a startup, MedTech Color has been so impactful to Navigate Maternity. We actually placed third at the pitch competition last year. Not only did we get an amazing grant from MedTech Color, but we accessed so many resources that have continued to help our business grow and help our traction. To piggyback off what my mom said, MedTech Color also provides community, which is so important for people of color within the medtech space. As we think about, to my mom's point, she came in at the executive level, but I didn't. I started, from the entry level up. And so when you're at those beginning stages, you need people to be mentors, to be sponsors, and MedTech Color provides that.
So I think the first thing is that you need to engage with younger people. So for instance, some of the things that I've done is I advise at innovation institutes. So the Texas Medical Center, TMC, they have an innovation center. I advise there. I advise for MedTech Innovator, and I advise in biodesign. And because of that, I also get the relationship with the people that run those programs and that fund them. And times when I felt that there was not enough diversity in the companies they were bringing in, I spoke up. I spoke up and said, wait a minute, why aren't you bringing in diverse companies? Why aren't you bringing companies that are led by people of color? Why aren't you bringing companies that are led by women? And having that seat at the table is really important to get change. Just to participate in a system that continues to go on the way it's been going, nothing will change. So you have to, if you get the opportunity to be in the room, you have to contribute your voice. That's really what diversity is about, right? It's about having different voices at the table. So you have to contribute your voice to the conversation. And I've definitely seen change in all three of those organizations. In fact, last night at the women's meeting, one of the women that was on the panel, Anna Samara, she was the first woman, and she's a woman of color and a woman, to win MedTech Innovator. But before her, there hadn't been many female-led companies at all that went through. So, and then the year after her, another woman won. So these are the things that are important. We have to contribute our voices. And then when people say, well, I don't know where to find them, be willing to help them. And so, hey, go here, go there. Do I need to make an introduction so that you can meet this group of people? And that's the thing that makes the change lasting. For me, that's in my experience.
Yeah, I think, to piggyback off what you're saying, Mom, I think it's so important that we continue to be intentional. Because what I'm hearing is that you're talking about being intentional with finding, Black and brown diverse talent, right? And especially for Black and brown women, it's so key. One of the things that I think as, MedTech Color, the things that we do now and we will continue to do is, making sure that we're intentional about fixing that broken rung for Black and brown women who are in MedTech. Getting women that even once we get in the door, it's getting from that entry-level role to that manager role. And so figuring out ways that we can continue to develop ourselves, partnering with MedTech Color so that we can have the resources, providing the resources for those women. In addition, though, making sure that we are getting the decision makers bought into this process, because we can have everyone ready to rock and roll. But if those decision makers don't commit to doing and hiring Black and brown women in those roles, then all of this is for naught. So I think that's our next call to action, is getting those folks to be bought in.
To the table. I actually had that conversation with Joe Mullins this morning about that, because the numbers that we saw yesterday, it's been 2% across the board for like 8 years. It has not changed.
Right.
And that's ridiculous. It's often reported that women of color are the biggest group of educated people in the country. So there's a plethora of people that could be in the pipeline.
Right.
But the people that make the decisions to hire have to be committed. It can't just be, oh yes, we believe in diversity. No, put your money where your mouth is and capture data. These companies need to capture data. They need to have data on their HR departments. They need to have data on their managers to see, are people, if the CEO mandates it, are people executing and following through with that mandate?
Agreed. Apply to MedTech Color's pitch competition, guys. The applications are open. Go do it now. Okay, so Navigate, we placed third last year, and it was an amazing experience. We gained so much, whether, again, not just from, actual capital, but we gained it from all of the resources that MedTech Color, cultivated for all of the finalists. It was really awesome. One of the things that I would say as you kind of really think about your application, really understand what they're asking you. So make sure that, you fill it out, but really answer each question. I think that was one of the things that helped Navigate to get to the top 10. And then secondly, once you're in the top 10, one of the things that MedTech Color does well is that you have this mini accelerator on the front end leading up to the pitch competition, and I found that to be very valuable. During that 4-week period, we met with some amazing players. I mean, they had people from J&J, they had people from MedMark, they had all these different resources for us, whether it be market access, getting insurance for your company, regulatory, so that we could really start to hone in and make sure that we were aligning not just in the pitch competition, but for our actual companies and for long-term strategy to be successful. So, engage, work hard, and hopefully I will see you at the finals next year.
So for me today, this breakfast was maybe one of the best, because the keynote speaker is like my same age, and our experiences are very similar. For years, people, even still now, but what are you? You know, what's your background? What race are you? Especially when my hair is long and straight like hers is. That was constant when I first came into MedTech. Then it was this feeling of the boys club, because it's also a big boys club in MedTech. It's not just about a diversity of different ethnic groups. It is overwhelmingly a male-dominated industry, right? So she had an experience that was very similar to mine, and I think that the way that she took her time and explained her journey, and I think there are some real nuggets for why she ended up being successful. Clearly, she came from a strong family background. She showed her Catholic school picture. She showed her grandfather, right? So her family was a huge piece. And then she explained about her life in ballet and the discipline that builds, right? Because to be successful in anything, you must have discipline. I don't care who you are. And then later, when someone tried to give her a artificial seat at the table, because that does happen also, she figured out how to get around that and still kept rising. And so for me, because she's my peer in terms of age and very much, I'm a lawyer also, experiences are very similar, yet we both figured out how to get there, right, to the C-suite. And that's what I want, you know, Ariana's age group, well, she's now CEO, so she is her own C-suite, but other younger people, younger women, to understand you're gonna face these obstacles. Don't ever think that you won't, but it's the community, and that's what she talked about very much, right? It's the community that will give you that bedrock to stand on and that will keep you going forward, that will keep you saying, I don't care what anyone says or thinks, I know what I'm made of, and I know what I can do, and I'm gonna show it. And you will find that path forward as long as you keep that. So, and keeping people around you that lift you up, that believe in your value, is what's gonna see you through those storms. And so, yeah, I thought her talk was excellent, excellent today.
Agreed. Yeah, no, I thought that Tanya was great.
Yeah.
And in addition to Tanya, and this is just my own, a little bit of bias, Vanessa, I was so excited to see her be honored today for all of her hard work that she does for MedTech Color. You know, Vanessa, I had an opportunity to meet her at the pitch competition, although I've heard her name for many, many years.
Yep.
And just to see her honored today for all of her work was, I think, personally my favorite moment.
And just to piggyback on that, Vanessa is the perfect example of a servant leader.
Yes.
She is a servant leader, and you know, she's at the top of her game. Like, there's no higher to go in the space that she's in. And yet she continues to help others and to reach back and to create a pathway that's gonna help open this industry up for all that are qualified, regardless of race, sex, whatever. That's what she's doing. And understanding that the patients are diverse. So if we don't have the voices of people that look like them, then we're not going to be able to service them, which is why we have such poor outcomes. But we're going to change that, and that's what MedTech Color is committed to, is changing that. And you know, Vanessa has really blazed that trail, and yeah, we love her.
Yeah.
We do. We love her.
We do. Yes, you will see us next year. So.